Thank you everyone for joining us this afternoon for this Adelaide Biomed City Research Mini-Review. We're presenting some work that's currently underway by our SA Pharmacy team with a particular focus today on collaboration and opportunities and use of the current data sets that we have access to. We've got two presenters with us today. Dr. Jacinta Johnson, who will be starting us off. She's a lead pharmacist for research across SA Pharmacy, and Alice Wisdom, who is a research lead within Northern Adelaide Local Health Network. For those of you who don't know me, my name is Sally Marotti. I'm the portfolio lead for research within SA Pharmacy, and I'll be chairing this session. I'd like to begin by acknowledging the Kaurna people as the traditional custodians of the Central Adelaide region and their connection to the land, the sea and the community, and we pay our respects to their elders past, present and emerging. I will ask if you've got any questions to use the Q&A function in Zoom, and we will share those questions with our speakers at the end of each of their presentations. This session will be recorded and made available on the AMBC website, where you'll be able to access this afterwards. For those of you that don't know, SA Pharmacy is a statewide service within SA Health, and it provides medicines and advice to public hospitals, ambulance, prisons, DASA and other outreach services across SA Health. Jacinta, our first speaker, is the research lead for SA Pharmacy, and she's also a lecturer in pharmacy at UniSA. Jacinta has an interest in practice education, medication safety and pharmacy practice research, and she'll be starting off with our first presentation. Welcome, Jacinta.
Thank you, Sally. Okay. So thank you for that introduction to what SA Pharmacy is. I think we're a little bit different to some of the other research groups that have presented in these mini review sessions, in that we are a clinical service with a really broad range of research activities. So we've got a lot of different projects on the go with different methodologies, from collaborations and lab-based projects right through to practice-based research. And the research topics that we look at are similarly broad. So similar to SA Health, SA Pharmacy does include research within our strategic plan, and we do have our own research priorities, but they are quite wide-ranging. So these are our research priorities here. So the first one is clinical research, targeting medicines in areas identified of local or national significance. And that's so that our research priorities align with the national health priorities and also with any other research priorities that are identified at the local health network level, but even at a finer level than that, so within a clinical service, for example. We also have some pharmacy service specific research priorities. So you can see the second one there is the development and evaluation of innovative pharmacy service models to make sure that we are delivering a service that is safe, effective and efficient. And linked to that, given the increase we've seen in electronic medical record use, robotics, automated dispensing and telehealth, we also have a research priority around harnessing technology to support safe, effective and efficient pharmacy services. So within the SA Pharmacy statewide service, Sally and I provide the research leadership, and we work with a network of research leads across each of the different sites. So within each LHN and within rural health, we have got a local research lead, and they support the pharmacists and the pharmacy staff within their local health network to get involved in research. And then we all come together regularly to look at research from a statewide perspective as well. And as Sally mentioned, the focus of this session really will be about how we can collaborate. So pharmacists really can bring medicines expertise to your project. So if you are looking at any research projects that involve medicines or people who take medicines, then chances are across SA Pharmacy, there'll be a pharmacist who will be a good fit for your project and have the expertise that you need to help build your research project with regard to those medicines. We also have a lot of pharmacists with experience in research and other skills that could be useful in your projects. And similarly, we have other pharmacists that are very keen to learn and to build their skills. So all of the pharmacists within SA Health do have research within their job description, and many pharmacists choose to get involved with research as an extracurricular activity. So we are also interested in collaborating beyond just projects that are based within SA Health. So if you do have projects out there and you're looking for a pharmacist, feel free to get in touch. But I'll spend most of my 8 minutes today talking about some more sort of formalised research opportunities within SA Pharmacy, because we do run a number of different programs that involve a research component for either our pharmacy students or for our pharmacy workforce itself. So I'm going to run through each of those programs now to give you a bit of an idea of what the opportunity is. So as I do that, please keep in mind any projects that you might have that might fit within one of these models. And then, as I said, get in touch with us to talk about collaborations. So the first one is the opportunity that comes with the clinical pharmacy student placements. So within SA Pharmacy, we host about 125 final year pharmacy students, each for a 6-week hospital placement. And as part of that placement, all of the students have to be involved with some research. So we set up a large statewide project, and each student during that 6 weeks collects just a small amount of data. So they might see 5 to 10 patients each and collect data from those patients. And then that all feeds in via a standardized form to create one really large data set. So you can imagine 125 students, even if they only see 10 patients each, they all gather just that small amount of data. We end up with a really nice, robust data set. And this is an example from 2019 where we had all of the students look at opioid prescribing before and on discharge to build a really nice statewide picture of what's going on in that space. Another example of how SA Pharmacy work with the pharmacy students in a research space is in that we host University of South Australia Frontiers in Pharmacy Practice students. So this is a research elective that the students undertake where they spend 8 weeks, full-time equivalent, gaining research experience. And during that time, they can contribute to multiple projects. They can, just start a project. They don't have to finish it A to B. And we've had a lot of students work with us to answer some important clinical questions in that way. And here are a couple of examples. So we had 2 students work with us and the rheumatology department in Carlin to look at opioid use, again here in their rheumatology patients. And then down the bottom there, you can see some published work where we had a Frontiers pharmacy student work with us to go through hundreds of discharge summaries to look at the handover related to medicines for geriatric patients, and that was conducted down in Sarlan. We also have, I think it's 15 to 20 interns completing their pharmacy internship within SA Pharmacy each year. And as part of that internship, they have to undertake a research project as well. So this is a year-long project that's coordinated by the intern pharmacist. They do sometimes have a few protected hours to contribute to that, but it's usually something that's practice-based that they can work on in addition to their usual intern pharmacist role. And these projects are really about introducing the interns to practice-based research as well. So some examples of intern projects that have been conducted over that 1 year period. Here we've got an intern who developed an illustrated medicines list for Indigenous Australians in collaboration with their Aboriginal health workers at their site. And then another intern here who did a project interviewing patients and looking at beta-lactam adverse drug reactions and delabeling some of those patients that didn't have a verified allergy. We also run 2 residency programs within SA Pharmacy. We have a foundational residency program, which is for early career pharmacists, or those that are new to hospital pharmacy. And then we also have an advanced training residency program, which is for more senior pharmacists. And both of these residency programs include a research project, and the residents have 2 years to complete those projects in addition to their usual role. So the foundational residents are usually quite new to research, but the advanced training residents often have some research experience already and are often specialised in their area of clinical expertise too. So some examples of projects that residents have done within SA Pharmacy. We had a resident who worked with the surgical teams within Carlin to look at what happens when we stop different perioperative diabetes medicines in the perioperative setting. We also had a resident working across country health, looking at using a telehealth model to deliver pharmacy services. And then finally, there are some formal research qualifications that we support within SA Pharmacy. So we do have a lot of pharmacists that go on to complete a Masters of Clinical Pharmacy, and often that degree includes a research component. And then within SA Pharmacy, we're also quite supportive of our pharmacists undertaking a Masters by Research or undertaking a PhD. And we have actually just implemented the SA Pharmacy PhD program. We've got our first candidate undertaking their PhD from this year. And within the SA Pharmacy PhD program, we actually support those pharmacists to reduce their hours. So they still continue to work within SA Pharmacy, so they maintain that clinical context, but they undertake their PhD at the same time. So our first candidate is looking at the role and the benefits of pharmacists attending ward rounds with the medical team. And this is an example of a Masters in Clinical Pharmacy project where the student actually developed an education resource that was a video, and then they went on to first review the literature in that area and then evaluate use of that educational tool. So I'll leave it there, but that gives you a bit of an idea of the different opportunities for structured research within SA Pharmacy. So if you do have any project ideas that you think might be suitable and you're looking for someone to help get your project off the ground, please get in touch. We may have a pharmacist or a pharmacy student that would be a good fit for your project. Thank you.
Thank you, Jacinta. That was really eye-opening. So if anyone has any questions, you're welcome to type them into the Q&A section. Given we don't have any just yet, I might move on to Alice's presentation and we can leave most of the questions until the end. Alice Wisdom is a clinical pharmacist and our lead research pharmacist for Northern Adelaide Local Health Network Pharmacy Department. Alice has a keen interest in mental health and has worked in mental health in many years, but she now supports and leads research within Lyell McEwen and Modbury Hospital. So I welcome Alice to talk about her experiences.
Thank you, Sally, for that introduction. Today I'll be outlining the opportunities and advantages of collaborating with SA Pharmacy with a focus on the staff skill set and access to various data resources. So building on from Jacinta's presentation, pharmacists have a broad and varying skill set and work across a number of specialty clinical and non-patient facing roles. So this includes general and specialty clinical areas, distribution services, clinical trials, manufacturing roles that involve promoting the quality use of medicines. So as a statewide organisation, collaboration with teams across multiple sites allows recruitment of a suitable skill set to study teams and also access to increased resources, support and data, while also streamlining statewide interventions. In addition to a wide knowledge base and skill set, pharmacists are embedded into the multidisciplinary teams and governance structures and can facilitate multi-D collaboration. So SA Pharmacy has an access to a wide range of databases related to medicine use, monitoring and governance. And this allows identification of cohorts of interest, access to larger amounts of data and higher level data around medicines, which often can be broken down to site-specific data or expanded to include statewide data points. So today I'll be running through a few common data resources with some brief examples of current SA Pharmacy projects. So the first one, which we use often within our SA Pharmacy projects, is our dispensing software. So the hospital pharmacy software, known as iPharmacy, is used to distribute, dispense and return medicines to inpatients on discharge and outpatients. So this provides us with a wealth of data points related to medicine storage and movement, both on individual patient level, and it also gives us the ability to run various reports to identify cohorts of patients. So a large number of reports can be run by medicines or by locations or units, and this system is used across the state. So state level data can be easily identified and compiled. So a number of SA Pharmacy projects involve the use of this resource. and it's often also linked to other databases. So an example of a recent project utilised iPharmacy information and linked that to the National HIT Registry to identify a cohort of patients prescribed denosumab on discharge, and using this data we assessed the impact of reduced renal function on hypocalcemia. Also becoming more prevalent is the use of dispensing robots and automated dispensing cabinets and systems. So these have been implemented within the Royal Adelaide and Lyell McEwin Hospital. So this gives us a further data set to track stock movement out of pharmacy and provide more detailed ward level data. So the next data set is the medication profiler. So this is a program used to generate medication lists by pharmacists at the time of discharge. And all historic profiles are stored and can be accessed by users. So this provides us with a valuable source of information, and it can be sourced by individual patients or reported on reports on individual medications can be extracted. So an example of a proposed project is looking at the evaluation of how prescribing has changed in a cohort of heart failure patients. So accurate medication lists can be accessed for an identified cohort and to establish changes in prescribing over a period of time. Another really useful data set is our individual patient use requests, or IPUs. So these are submitted to our local drug committees to initiate or continue a medication that it's not on our statewide formulary, which is a list of preferred medicines that can be initiated in hospital. So the governance is responsible for approving and monitoring the use of these medications and require detailed information regarding justification for their use. So on initial prescribing, information will include to justify use will include previously trialled medications or unsuitable treatments, and a plan for monitoring and continued medicine supply. And then renewal or ongoing prescribing requires detailed information for including response to treatment and adverse effects. And this may be anything from pathology results, clinical assessments, or information such as sleep or seizure diaries. So pharmacy keeps a record of approved and rejected IPUs and a copy of the application. So it's a really useful, it is a useful database to identify particularly off-label use of medicines and can be used to assess the success of treatments. So a good example that was published recently looked at IPU records to identify off-label use of lidocaine plasters and assess the duration of use, efficacy and tolerability, all through using the IPU requests. The SLS system, or safety learning system, is used across the hospital and records incidents that could have or did lead to unintended harm. So records information around the incidents in both free text and predetermined data fields, and records can be filtered by incident type and filtered down to specific medications. So it contains patient details, so the incident can be linked to other data sources as well as location and outcomes. So this is another example of a statewide database. So a recent SA Pharmacy project conducted looked at statewide incidence of hydromorphone over a 2-year period. So this is a really good example of how we've utilised a statewide database to allow a greater sample size. So the safety learning system is a useful resource for capturing incidents, particularly those that may not occur frequently, or to compare patterns across locations or timeframes. Additionally, it can also be a useful additional source of information to compare trends in incidents following changes in clinical practice or clinical interventions. Other sources include Sunrise, so replacing the physical medical records, and can easily allow efficient access to patient data and across the sites that Sunrise has been launched. So it's really easy to pull data across the state from a single site. So a recent project utilised Sunrise to assess the implications of holding an anti-diabetic medication pre-operatively. The next one, the Quality Information and Performance Hub, contains various data sets, one of those being hospital-acquired complications. So one of the recent projects proposed is looking at investigating hospital-acquired complications for hemorrhagic disorders due to circulating anticoagulants. So this was a project that was identified through a change in hospital-acquired complications through one of our governance meetings. And finally, CBIS, or Community-Based Information System. This is a mental health medical record system and that runs across both inpatients and the community. So one project that was recently carried out in SA Pharmacy was looking at the transition to the 3-monthly paliperidone injection, and through this we were able to identify patients initiated in the community and then track them into hospital to look for hospital readmissions and link that to data sets within the hospital, and we did that all from the hospital offsite at the hospital. So thank you. This gives a brief overview of some of the data resources and the diversity of skill sets that SA Pharmacy has to offer, and I really hope that we can collaborate with some of you in the near future.
Thank you for that, Alice. If anyone has any questions, you're welcome to type them into the Q&A section of Zoom. This question is probably more for you, Jacinta, or Alice. If someone had a research question in mind, a research project involving medicines, how would they go about identifying someone that might be suitable pharmacist to work with them?
Yeah, great question, Sally. As a first point of call, I'm more than happy to field any inquiries myself. Given that I work across all of the different LHNs, I can help to direct those queries as needed. So you can reach me via email at jacinta.johnson@sa.gov.au, and my email address is also included in the slides, which will be available with the recording for this presentation. And also at the beginning of my slides, there was the contact details for the research leads. So if you're working within a particular local health network and you'd like to get some input from pharmacy within that LHN, then you are welcome to contact the research lead within that local health network directly as well. And their contact email addresses are included on that early slide.
Great, thank you for that, Jacinta.
Thanks.
It sounds like there's lots of really exciting projects happening across SA Pharmacy, so it's really great that you've been able to share that today. I will finish up there by thanking both Jacinta and Alice for their generous sharing of information and research ideas this afternoon, and welcome you all to get in contact with either of them if you've got any further questions about SA Pharmacy and working together with research.